Hi, good evening, everyone. I'm about to be joined by Divya, who is a Harley Street Fertility Clinic patient and also medical director of Harley Street Fertility Clinic, Dr Venkat. And we're going to talk about managing your relationship whilst you're trying to conceive, which, as many of you watching will know, can be a terribly, terribly difficult thing to do. Good evening. Hi,
Good
Divya.
evening. I'm well, thank you, Eloise. Hi, nice to be here.
Yeah, well, thank you so much for joining. We're just waiting for Dr. Venkat to arrive. I've just given you a brief introduction, but whilst we're waiting for her, please could you tell everyone who's joining who you are and where you're up to in your own personal fertility journey?
Sure. Hi everyone. My name's Divya Parker, a bit shorter than my maiden name, as you might imagine. My husband and I, Tony, that is, he's not with me at the moment. We've been going through IVF since late June 2020. So just as the IVF clinics began to reopen after the first wave of COVID-19 hit. And we are actually on to, I hesitate to say 3 rounds, probably about two and a half. So unfortunately, the first full round all the way through to embryo transfer didn't work. And we have got two frozen embryos from our second round of egg collection. But unfortunately, our third one didn't go at all to plan. And so hence the, are we two or three? Because I know everybody counts it slightly differently.
Yeah, yeah, so difficult. And thank you so much for, of course, being here and talking about this because I know that it's very, very difficult. You you suffered, am I right in hearing, a miscarriage? Was that after your first transfer?
No, so actually, the miscarriage was what started the whole journey off. So not long after we got married in 2019, I discovered, lo and behold, I was pregnant.
That
And as many of our lovely people joining this live video may have endometriosis or polycystic ovaries, certain conditions obviously can increase the risk of infertility and or even increase the risk of miscarriage. So to fall pregnant felt like an absolute miracle after 3 operations, all the drugs that came with it, completely out of the blue. Unfortunately, we got to the 12-week scan and we did, and the reason I always refer to them as jelly bean, because at the end of the day, it doesn't matter when it happens, it's a loss of a life, a very precious one. So we lost jelly bean at 12 weeks. And rather than it being a case of nature taking its course, I experienced some pretty dramatic complications after the miscarriage and ended up needing emergency surgery on Christmas Day.
oh my goodness, so awful.
Uh, December's probably not our favorite month, so for a lot of reasons, but we decided to try for 6 months, and in view of our respective ages, background medical issues, we knew that if by 6 months nothing had really happened, that we needed to get some medical support. So we didn't really beat around the bush come when the 6 months came and went.
I just want to, sorry to interrupt you here, Dr. Venkat, she's joining. If she's watching, just to say, please join via mobile, because sometimes if you're via computer, it won't let you in. So I will just keep checking to see when she's there to room. But I'm so sorry. That's just an awful, awful thing that you've had to go through. And so, did you embark on IVF 6 months after that then?
So after the actual miscarriage in December 2019, by the time we got to about May 2020, we'd already started speaking with Harley Street Fertility Clinic and Dr. Venkat, who, as I'm very fortunate to say, she's actually known me since childhood. So I wouldn't put any bets on what she might be able to tell you about me being a little girl or not. Hopefully nothing bad. But she's obviously got a wealth of experience in managing gynecological disorders, but also the fertility and family planning side of things. So when we came to speak to her at the end of May, early June, it was pretty clear that we'd probably need a bit of help, but also that we didn't really want to be anywhere else. And having that rapport with your clinician from the get-go, whether you
Oh,
receive,
it's
it makes a difference. Having whatever
such
they'd have to tell you, to know, to have that real sense that, you know, that they will, even if they have to call it, that they will always think, you know, treat you as a person first and the patient second.
yeah, exactly. I think because I heard a podcast that you did for Harley Street Fertility Clinic, and in talking about how Dr. Venkat called you, I think to let you know that the cycle hadn't been successful, sadly. And it's, you know, you mentioned how obviously she had a long, busy day, but just hearing that news from the specialist kind of um, helps you feel that rapport, and you feel connected knowing that they've got your back and they
Oh,
will
absolutely.
you, and they're there with you during the highs and they're also there with you during the lows.
Yeah, and I think not just managing the relationship between, between you and your partner, but also when you think about it, this whole journey affects every relationship that matters. Your relationship with your parents, your friends, whether they have children or not, and obviously that's a whole different issue. But also the relationship that you have with the people looking after you at your IVF clinic, that will have an impact on your day-to-day relationships when you're not there, because you need to feel like you can almost switch your brain off, switch your feelings off for a little bit, and kind of delegate that responsibility and say, right, I'm in your hands for the next half an hour, 45 minutes, however many hours, and then I can just walk out of the door and I'm just going to carry on being me.
Yeah, and put your trust in them. It's vital. But
Oh, yeah.
hopefully everyone will get to know Dr. Venkat in a second when she joins. She's absolutely lovely and has a huge wealth of experience. Um, we're talking tonight about managing your relationship, and I also know a fertility patient, ex-fertility patient, that it's one of the toughest parts of it, especially when you're doing it together, but you don't feel like you're wanting to talk about it at the same times, and you may not be, well, from my own personal experience, may not be reacting in the same way, which can
Mm.
the feelings of kind of, why are you not as upset as me, or why are you reacting in that way, or I mean, our story was donor conception, so we had sort of the genetic grief going on at the same time. But tell me about your relationship. How has that been for you during this whole process?
So much of what you said has just resonated with me so brilliant. You have just hit the nail on the head, that so much of the journey is about wondering, even if you can talk about certain things at the same time, you do wonder, are you feeling the same thing as me right now, or are you feeling it to the same depth, the same complexity, or conversely, is it, why is it not such a clear-cut decision for you when it is for me?
Yeah.
um, so going from round one into round two, and technically we'll call it round three. The first round of treatment, nobody will ever really know what to expect, irrespective of your background. And just for anyone who's listening in, so my as a background, I qualified as a pharmacist, and I went into research, and then I came out of research. So I have got a clinical background. Doesn't mean that it helps me in any way when it comes to the roller coaster. It's a very strange feeling, thinking, yes, I can pin my hat on those facts. I know the X, Y's, and Z's. It doesn't stop the roller coaster one bit. So one of the initial challenges with our relationship was that I had the clinical background, but Tony didn't. And that is not to say in any way that, in terms of understanding where each of you is coming from as you begin this journey, you can't expect there was never that expectation that he had to suddenly do a crash course in, reproductive endocrinology and fertility medicine. I mean, aside from the fact that, his head might have exploded. it wasn't really that kind of understanding that really matters. So it was more the sense of, for him and for me, when we realized that, because I was the one with diminished ovarian reserve, and obviously I would be the one that needed the active treatment, for him it was a sense of, well, what do I do? Do
How does
I
Is it emotional? Is it physical? Is it a mixture of both? Maybe he was sometimes, and again, talking about my own experience, waiting for you to tell him what to do, but sometimes you were probably thinking, how do you just not know what to do?
Oh, completely. And I'm sure there are probably, thousands of women all over the world who think, come on, I'm going through a million and one things all at the same time just to get to egg collection. Come on, please help me here, meet me halfway.
Yeah.
But the fundamental thing for me, and I don't know if I can speak for anyone else, was is that I had to really learn how to articulate what kind of support I really needed, because I had been so used to managing everyday life with endometriosis, taking myself off to the consultant if I had a relapse, organizing all of the theatre arrangements, plans, obviously with family to get back home and recover and whatnot. So I've been so used to kind of managing my own health and, those sorts of troubles on my own. And for me, it was, I'm ashamed to say, it was probably pride, thinking I can do this. I don't need any help. I will just tell Tony everything will be fine, and everything will be fine. But then that doesn't help his feeling powerless. And he wanted to help. He just didn't know how. But what made the situation more challenging was that for a lot of complicated reasons, he didn't really know a lot about IVF when we went through it the first time round. So it was an additional challenge on top of everything that IVF naturally brings with it.
Definitely. And it's hard, isn't it, when the focus is on the features and everything, it's hard not to feel, look what I'm physically going through here, because it's really, really tough. But then obviously it's so tough on them as well, because they're trying to help you out and try and understand what you're going through. And then if there's male factor involved as well, there are so many different layers of complication. Good evening, Dr. Venkat.
Hello. Yes,
We made it.
I had some technical problem. And hi, Divya. Hi, Eloise. How are
Hi.
you both? Okay.
How are you? Are you well?
I'm doing well. Yes, very well. Thank you. Thank you for asking. And sorry about the delay.
No problem. So welcome back to those people who've come back. We've just been talking about our personal experiences of struggles with relationships whilst going through fertility issues. I guess from a medical point of view, or from what you've seen at Harley Street Fertility Clinic, obviously having been the medical director for many years, do you see couples responding in different ways and starting to perhaps distance slightly whilst treatment goes on?
Correct. That is absolutely right, because we always say the relationship has to be strong to start with. If it is really shaky to start with, having a baby through IVF treatment is not going to bridge the relationship. And I feel that sometimes, as you say, this treatment with its own stresses adds to the trouble in the relationship. And people, the behavior or emotional dealings of the male is very different from the female. The females want to talk about emotions, whereas the male don't talk about the emotion. It doesn't mean they don't understand. They do understand, they feel it, but they don't talk about the emotions like the way we women do it. We'll say, oh, it was horrible, I had to do all those injections and I was feeling hormonal. I was not at all myself. We say all these things. But men are not like that. They are solution based. They always say, look, if you are suffering, keep quiet. Just go to bed. You don't have to mix with others. You don't have to attend any social, functions or anything like that. So they come with a solution. They don't listen to you and say, yeah, I feel sorry for you, you're suffering. They don't acknowledge the emotions and the feelings the women have. And they somehow don't like talking about it, basically. That's why the way the man and the woman deals with the emotions is totally different. When the treatment doesn't go according to plan, it's not, if it is not successful in the first attempt, and then people have, they carry themselves in different ways. They are not able to help each other. And I see this more in ICSI, ICSI treatment. I don't know, Eloise, if you have experienced, because the woman feels that she has to go through all these hormone treatments because the man has a sperm issue or the male factor. And she wants more sympathy and more attention, more saying, oh, you poor thing, you're going through all these things for no fault of yours, and this kind of talk. But I don't think she gets it from the partner, because it's not that he doesn't understand, but they are not that kind. They are very different. And then it adds to a strain in the relationship. But of course, Divya will be able to tell us more because she's the first-hand patient, and she has been through this difficult path.
I want to ask you, Divya, would you say that with the first round and the second round, both you and Tony, did you respond in different ways when you found out that they hadn't been successful?
Very much so. In fact, I think the differences began to be quite apparent in the run up to transfer, and then obviously when we got the news that we did. So to Dr. Venkat's point, we were both feeling things quite deeply, but at different times and at different depths. So, for example, to Dr. Venkat's point, when I would say I'm feeling absolutely horrendous and bloated, and I'd managed to keep it together all the way up until the actual egg collection. And anybody, unfortunately, who's been through it knows it's very rarely the build-up that causes the problem. It's the aftermath. Because Tony didn't really have an understanding of what IVF entails, but also why I was feeling so sore physically and mentally. Again, going back to that pride, that I didn't want to say I feel absolutely vile, even though he could obviously see it. So that admittedly there was a disconnect. And I mean, looking back on it now, I mean, my heart just bleeds for him, because he was trying to help. He just didn't know where to begin. When we got to the transfer and the news that we did, it brought up another issue that made me realize, for months, I had thought that he hadn't gauged how painful the memory was for me. But he just didn't say anything. And he was coming to terms with it in his own time, on his own terms, in his own way. And it was the fact that the day of the embryo transfer was the day that I was blue lighted to the hospital, hemorrhaging after the miscarriage.
Oh my gosh.
And up until then, Tony had never told me that he was genuinely petrified as I was wheeled into theatre the next day. Because poor Dr. Venkat has had 2 rounds of experiencing this with me, that my blood pressure was in my boots. I was absolutely exhausted, on IV fluids just to prop me up until they could get me into theatre. And I was a bit of a mess. And he was absolutely convinced that they would wheel me in and I wouldn't be coming back. And he hadn't said that. At the time, I remember this, December the 16th, I remembered that was the day we had the 12-week scan and got the news. Tony remembered the date, but he hadn't articulated that he remembered. And it was only after the transfer, when we were in the middle of our 2-week wait, that all of this sort of came tumbling out. And then the penny dropped of why we were both on eggshells, that the transfer had brought back lots of memories of, oh my goodness, here we go on this day again, we're here again.
Mm-hmm.
I was having flashbacks. Tony had obviously he was very aware of what had happened at the same time last year, but we couldn't really speak about it because we were feeling very deeply and feeling a lot of pain, but in different ways.
Definitely. I'm going to ask people who are joining whether they feel the same. What have you experienced with your relationships? To that point, when mine and my husband's first round of donor sperm IVF failed, I reacted very I literally stripped off my clothes, was so hot, was shaking, had a migraine, stopped crying, was trying to drive, couldn't drive. It was awful. And he didn't seem nearly as upset. And then I got upset that he wasn't very upset. And he just said, I think I am upset, but I feel like we weren't ready for it to work yet. And then that made me think, does that mean you don't want to use donor sperm? And that just set me thinking,
oh, bless. Oh.
And so when people react in different ways, it can be really hard in your relationship. I mean, Dr. Venkat, do you find that seeing same-sex couples as well, do people tend to have similarities with their relationships and how they respond, or does it just depend on the person?
No, it is actually, it depends on the persons involved, and you are right, absolutely there, Eloise, but it also depends on the relationship with the couple have, because we have had a lot of same-sex couples recently in the last few years, who want to have participation from both sides. Like, you know, one person is using the eggs and the other person is carrying the baby. Okay, that is the arrangement. When they come for fertility checkup, what happens is the lady whose eggs are going to be used, and say for example her AMH is not good and the other one's is good, then that affects their relationship, because look, they are not able to go ahead with their plan. That means they have to change their plan, and it affects. And then to, you know, just to digest that news and move forward, it is difficult again for them. They do have similar feelings, but again, the person who is supposed to be the dominant one there, they don't express so much emotions. So that is the way they also have issues. And comparison also comes into play there. Like, so-and-so's AMH is better and the other one. So similarly, recently, you won't believe we had the same-sex male couples, 2 young boys. In fact, I have delivered one of them in my job in Eastbourne Hospital.
Oh, wow.
Some 20, he's 22 or something. I delivered him at that time, and he has a partner. They came for treatment. They wanted to use, both of them wanted to use their sperm for the treatment. And we matched the donor, egg donor, and then we divided the eggs and fertilized with both the sperm. And there was always comparison. See, my count was slightly lower and it was not so good as the other one. And then the fertilization was one embryo less. So he was, you know, like upset. The other one's embryos were doing well. So he was little down and depressed. You know how it is. It's like comparison comes into play here, same-sex couples.
That's
like
about that, because you are comparing the same, you know, bodily functions, I guess, aren't you? You're doing the same thing at the same time.
Yes, and then I had to call them and say, look, don't make it a competition between the two of you. You wanted the baby, you're doing it. You have what you have, but we'll make a baby from both. Don't worry, and don't make it a big stressful point between the two of you, because, you know, I sort of talk to them in such a way like their mother, you know, I talk to them so they understand, and so they calm down. But that comparison comes, and the same thing with the female, you know, same-sex couple. Egg number is down, mine eggs are not so good, and others, she has got better eggs, so better use her eggs, and this and that. All those things, they come into play. But at least one thing is they are more supportive with each other, I would say, because females talk, isn't it? So it's easier to talk to the other person, and whereas man's way of listening to the problem or emotion is very different. They don't react the way we would like the man to react, isn't it? You must have experienced when you went through Elias, you know,
Yeah.
it must have been difficult.
I don't need counselling, and I said I do, and he just sort of humoured me and came to one session, and I cried through it, and he just walked out at the end and said, I'm not doing that again. So I don't know, Divya, have you had counselling? How has your experience been of that?
So we did have counselling. So admittedly, I've had more solo sessions, but in terms of probably what, in spite of the sort of this almost maelstrom of anxiety, nerves, hurt, tensions rising in the run up to the first embryo transfer, and then obviously the aftermath, one of the things that did actually bring us together was a joint counselling session that didn't go very well, but it forced us to take a step back and say, is what they're saying really valid? Is this really who we are? Really? And it was a session that I will admit that left me very, very distressed. And at the time, the session was too short, which meant that the counsellor in question probably didn't have enough time to really build a dynamic with us anyway. But basically, to cut a long story short, the output of that was apparently that for months and months, I've been expecting Tony to have a scientific background on the level of a consultant, and that my expectations to support me were very unfair, and that Tony didn't have to know anything about IVF if he didn't want to, and that we should just relax and go and have fun and try and unwind and step away from the situation. The latter point I agreed with. I mean, and also very difficult to do when you're in the middle of a lockdown, you know, that nowhere to go, not really much of an outlet beyond walking the dog.
Yeah.
But bizarrely, as I was practically in tears for the rest of the afternoon, and I remember literally staring at the wall in the living room saying, is it me? Is it all my fault? Am I the one to blame? Am I really so horrible? I mean, I know that, and I said, I know that the drugs are doing terrible things, but is that really how horrible I am? And he said, no, you're not. And he said, yes, you are having some pretty terrible mood swings, and I can see you battling them. But no, you're not. You've never expected me to have a consultant level of understanding. That's not you. And going on record, I realized Tony doesn't have social media, so he will never know that I'm saying this, but going on the record, from then to now, every single time he began to step up to the plate, and he said, it's becoming incredibly clear how little I knew about IVF and how much more I could have been there for you.
But also, you've been going through this during a global pandemic. I mean, that must have added another layer of stress on top of what's an extremely difficult process anyway. Dr. Venkat, have you found that patients have been perhaps struggling more with their relationships in some ways because we've been living and breathing with the people we're living with, and it's been something that we've never had to experience before?
Yes, that is true. And like you said, people are not able to socialize. They are missing their friends and relatives, and they are not able to talk to anyone. Both sides, I'm saying, the female partner as well as the male partner. And that's why it becomes more difficult. And also they find that they're not able to see the counselors face to face in a room. Whereas now they are doing these Zoom consultations or sometimes telephone consultation, then it is very difficult. They can't really open up with the counselor and give, I tell them what the problem is, because otherwise what happens is if you sit in a room, the counselor will find out from somebody's face, like what's happening. There seems to be something else here. and they can find out, ask more questions, get to the bottom of things, and see they can give tips to help themselves and other things. So the patient couples are saying that nowadays, because of this pandemic, it is becoming more difficult to access counseling face to face, and they are not able to talk. Even with the nurses, previously, our clinic, even though they don't see the counselor, they used to sit with the nurses, spend some time. Now they are all limited, and the partner is not allowed in the scan nowadays with the pandemic. That is more difficult. Previously, at least partner used to be there when we used to scan the patients, and okay, so many follicles. Do you have any symptoms of OHSS? We ask them, is your tummy bloated? Do you feel sick? How do you feel? How are you coping? We ask them. So the partner knows that they could go through so many things. But now the partners are not allowed to come in, or even if they come in, they sit in the waiting room. They're not allowed in the scan room. In fact, they are not allowed to come in before the egg collection. Or previously, we used to have the partner for the embryo transfer. But with pandemic not happening, so patients miss all that. Both sides, the male misses the embryo transfer part of it, seeing the embryo and everything. The female feels that she doesn't have any support. And they can't talk about, like supposing some stage in the treatment doesn't go according to their expectation or plan, they don't know where to go to or turn to now. And with the pandemic, more difficult because there is no face-to-face interaction.
Because I had my embryo transferred in America, and my husband had to go home to work, and so I never, as you've probably experienced from the pandemic, I never had him by my side. Even for egg collection, my father-in-law came with me because he was in the bed recovering from his micro-TESE operation the day before. And he felt very disconnected from the whole process because donor sperm, he didn't come to any of the procedures. And I just called him, lying after the embryo transfer, saying, it's happened. And then it was the 2-week wait, and that was it. So he really felt very disconnected from it. And then obviously for us, donor conception, pregnancy again, other levels of the unknown during that time too. So I think it can be really tough for both parties, whatever the situation is. And yeah, Dr. Venkat, do you, I know you offer counselling at Harley Street Fertility Clinic. How can people access that? Is that part of the treatment plan?
Yes, it is. We offer 2 counseling sessions free for them. And if they want more, we offer them if necessary. And that is part of the treatment. We also tell them if they want to prepare, they can access counseling before starting the treatment. Or if they find it difficult during the treatment, they can have it. Sometimes if the treatment doesn't work, it's a big fall for some couples who have high expectation. And then also it is a good idea to speak to the counselor. But sometimes, couples say, oh, we don't need that. We are good with each other, like we are supporting each other. But it doesn't help. They don't understand because you need a third person to make you understand, look, you haven't done anything wrong. This is not your fault. It is one of those things you have no control over. Both of you are in this together. And because they are in this together, it's difficult to offer support to each other in that position. And if something inside didn't go well, supposing the sperm is not good, and because of that treatment didn't go well, the man becomes very down and said, it's all my fault. And the other person will say, or if the egg has let the treatment down, they will say, she will feel it's guilty, like, it's because of me. Recently, we had a couple who went through the treatment, young couple, straightforward. We thought there should be no problem. And what happened? He had some infection in the semen culture. We put him on antibiotics and everything. But in spite of it, they had beautiful embryos, but embryos were all infected with the bacteria.
Really?
Oh, yes. And we couldn't transfer the embryos. So we were calling them and we washed the embryos every day, but still we couldn't. And where we called them into the clinic, I explained the situation. Look, I feel very, very uncomfortable. We are not going to transfer the embryos, but you have The embryos are really good quality. And the woman said, okay, at least we know that we can make good quality embryos. That's progress for me.
Yeah.
It's all I can do another round. But the husband felt very guilty. He said, oh, it's because of my infection. The embryos are infected and you have to do the whole thing again. And he withdrew and he couldn't talk much. And it is difficult. Then I told them, look, go and speak to counselor or somebody. And I spent a lot of time with them because they sort of look up to me. So I spent time with them and asked them to speak to the nurses, because each person's emotion is very different here. That is the problem. I said, if there is donor sperm, the man, I don't know, they don't express it. You don't know how they are feeling. Isn't it? For you, you can't ask him, Eloise, isn't it? When he was not, yeah.
My two pieces of advice, I don't know what you'd say, Divya, but would be to work out what you want to say to people as a couple. So, you know, you're not worried about saying something that the other one doesn't want you to say. I felt that because it was male infertility, I felt like I couldn't really talk about it because he didn't want me to talk about it at the time. He's fine about it now because of what I do and he likes raising awareness, but at the time he didn't. Even when he got the diagnosis, we didn't know why he had azoospermia at that point. And my family were abroad, and the first thing I wanted to do was call my mum and talk to her and tell her. He said, until we know. And I couldn't. I just said to him, I have to speak to her. And she could just tell as soon as I started crying on the phone what it was about. And then I said, please, could you not tell Dad and my sister and my brother who they were away with? And she said, okay. And she went back to the table crying, and they said, you know, they'd obviously just known she'd spoken to me, and they said about having a baby, and she just said, I can't speak to you about it at the moment. And obviously we told people in time, but it was working out who's comfortable saying what, and exactly, whatever that might be.
Absolutely. And also you did what came naturally and what would come naturally to anybody, to you and to me and to any of the other IVF patients listening to this. You need to be able to tap into your support network, whether that's a parent, okay, ideally in a perfect world your partner, but it's difficult if they're hurting too. And you also need to, it's not just the clinic and your clinical team that needs to have your back. You need to have each other's backs, especially when you've got pardon the bluntness, two problems for the price of one, which is exactly, to going back to something that Dr. Venkat said happened to Tony and myself in round two, because a long-standing condition that Tony had, it flared just as we were taking the progesterone tablets and this, that, and the other, and we were getting ready for ovarian stimulation, and poor Tony was absolutely grief-stricken, and he didn't know what to say, how to say to whom, what, bearing in mind that I was still on the road to recovery as well, and then having to sort of present. The most important thing for us was that we had to understand and step back from the situation and say, well, look, as painful as it is, it's not our fault. So there's only so much we can control. But also, when I was floundering and struggling with recovering from the unsuccessful first attempt, he was the strong one, the sensible one, saying, you feel rubbish now, just keep going, one thing at a time, one day at a time. But then when Tony fell ill, I had to then step up to the plate and support him. And as Dr. Venkat will know, we had a couple of phone calls trying to work out what was wrong with Tony, and obviously who was the best specialist for him to see, in view of the fact that we had this second round coming up very fast. And the most important thing that I found in terms of what to say to other people about what was happening to us was, we took almost a very clinical approach, that if depending on who asked us, we would be very honest and tell them exactly what was happening. And if it was somebody who we didn't feel we could trust with that level of confidence, then we would just say, the first attempt didn't work, we're going through a second round, and that would be it. One thing I do remember, for example, that somebody I had only met twice made a very offhand comment to Tony, luckily before I had arrived on the scene. And this just goes to show how important it is to know, to almost get inside each other's heads and literally walk a mile in the other person's shoes. How would they feel if they were, bombarded with this information? And the person said, oh, well, I've heard of lots of people giving up IVF and then they suddenly become pregnant. I'm sure that's what will happen. And I am so proud to say that Tony said, don't you dare say that to Divya. It won't help. And then my father-in-law joined in. And my father-in-law is 87 years old. He does not have a scientific background, but that was the moment that I thought, yes, this is where we need to be for round 2. Yes, it's going to be harder, but this is where we need to be, here and here.
Mm-hmm. Totally.
That kind of united front that then feeds out to all the people who we need to be there for us.
Yeah. I mean, my husband is so dry and sarcastic. His way of coping with it, when people have made comments or say, it's amazing how many people say things about fertility without realizing what they're saying, especially men to men, about, oh, you firing blanks, or just some sort of something around, how fertile they are, how manly they are, as how he felt about it. And he'd just turn around and say, I'm actually infertile, loudly. And
deadpan.
And then everyone would go, oh, sorry. Just to respond. And it's part of him wanting a rise to just stop people saying things and asking questions, that if they want the answer, there it is.
Yeah.
What do you say to that? I mean, obviously not acts like that, but that's just his personality. But it's taken years for him to get to that stage, but he's now very open about it.
Yeah, as you say, it takes years to get to that stage, because initially they will all react, they will be upset, angry, why it's happening to them,
embarrassed.
They go through phases. Yes. And for a man, this is so important, isn't it?
But going back to what you said earlier about, thinking, is it me? Are they okay? I mean, this is obviously moving on from the fertility part, but it's still connected. I was very conscious through both of our pregnancies that my husband was struggling at some points, like scans and things like that, with worrying about bonding with the children and that kind of, because of the uncertainty of the donor sperm and him not physically being part of the carrying process or even the IVF process, really. And when our first daughter was born, after I'd been in labour for 2 days, the first thing I said was, "Are you okay?" And it's kind of like that was the first concern, was he okay? Whilst I was sort of, whatever was happening down there and just sort of shaking, and that was literally the first thing I said, because I could see his response and I wanted to know if they were happy tears or apprehensive tears or sad tears, or what they were.
Yeah.
It is true. People have different emotional reactions to all these things. But I think in men's case, they also take it very personally, because, this male factor issue, they think it is, I'm not a man, I will not, the society, how will I walk in the society with my, head high, held up? Though they have all this stigma attached to that. Whereas, of course, for a woman also, it is important using her eggs and everything. When they go for donor eggs, it's different. But somehow the woman is able to, it takes time but comes to terms with using the donor eggs, where the donor sperm is more difficult for men, I think.
Do you see a difference in people who may have a diagnosis of unexplained infertility or unexplained fertility versus an issue where, it might be a combination of the two, or it might be male factor or female factor, where there may be a feeling of blame or guilt, which there obviously shouldn't be, but it can happen?
Yeah, that is true, because they always think that, okay, her eggs are not good, because I married her eggs are not good. She's slightly older than me. Some feeling like, I always tell them, look, you should not blame each other here. You are in it together. And it's like a health condition. Who knew that this was going to happen? And so we have to support each other. It's not anyone's fault. He has not created this or she has not created this. It's one of those things we need to give support and help. But I think when you are going through so much stress, it's all difficult to see things clearly. And isn't it? I think their mind is like confused, and so many issues are there about this baby. We are not getting pregnant when, we have to do so much to get this baby, whereas others have it easily. And all these complexes or thoughts are going into their mind. That is why I think for a person who is in that situation, any additional stress becomes a major problem, and they are not able to deal with it. And counseling is very important, but also you have to have the right counselor who understands all these things. So like Divya said, first of all, the counselor needs time. She should forget about everything and listen to the 110% attention to this couple who are in front of you, because they are struggling with something. Here I am to help them. First of all, let me listen to what they have to say and then do something about it. It may not be over in one session, it takes a few sessions, but you must also feel that you can talk to the counselor, open up with the counselor, because you somehow get that feeling, she's not interested, why should I say much about it? You get that feeling. You have to get along with the counselor and like that person, to open up and talk to her. And she should also listen to you properly. Show the body language is very important. Even though she's nodding her head, doing something else, you know that she's not interested and like that. So you must have the right counselor, and counseling plays an important role in all these things. That is why we have two counselors, because if some patients don't get along with one counselor, we arrange for them to see another counselor.
That's really good. We did a together before Christmas about holistic support, and one of those was acupuncture, and then another part of that was counseling. And a lot of people, I'm sure they come to you and ask this too, but I get a lot of questions about ways that you can support yourself through mindfulness and mentally, as well as the physical side, so the emotional side too. So it's wonderful to hear that plays such a big part in the process at Harley Street Fertility Clinic. And also you give people the opportunity to work with a counsellor if they don't particularly gel with the one that they may have met.
Correct. And we also offer them, if the stress is due to the treatment, because sometimes the treatment is overwhelming due to the hormones and other things. And supposing the one day the patient comes for a scan, they hear from the nurse, oh, you are not responding well. Then it goes, you feel down that day. Next day, say, okay, the follicles are growing. And then next time you come, they say, it's not growing as fast as I would like the follicles to grow. Some comment like that. And then you feel so, you got so many emotions. And then we say that, look, if it's all too much, go and have a chat with the acupuncturist. We had two acupuncturists before COVID-19, because again, for the same reason. If someone doesn't like one acupuncturist, she can go to the other one. We had it, but with the COVID-19, we stopped in between, so things changed. That is why we always like to have options for the patients. It's important. One may not get along with one person, therefore it's better. Doctors, nurses, if they don't like one nurse, they can see another nurse. And we have a lot of nurses who are experienced, who sort of can give them all the support. Look, yes, you are having a difficult time, but you get through it. And then when you get pregnant, you will forget all these troubles. So they are able to reassure and give them some hope. These are all important. So we have experienced nurses to talk to the patients when they are going through difficult time through the stimulation, like Divya said, it is not easy for anyone to go through that. And with the hormones making it more difficult, more emotional, and they sort of suddenly burst out when you say some one word which you didn't mean something serious. They burst out because this is waiting to come out, all these emotions. That is the reason. And we always take them to a room and sit and talk to them. It is important. This is the main support we need to give to the patient, because we say we hold your hand. That's what it means when we do these things, because we treat everybody as a human being first. Everyone is a human being, and each person is also different. That we have to understand.
Someone's just asked, can stress affect results of IVF?
Sorry?
Can stress affect your chances with IVF?
Yeah, it does, because how stress plays its effect is it makes the hormones go up and down. So there is a lot of hormonal imbalance and fluctuations. And that's why it affects the stimulation process, and it affects the preparation for the embryo transfer and implantation stage. So everywhere, it's easy for anyone to say, don't get stressed. It is not. There is some underlying issue there, and they are not able to cope with that. That is why the stress comes into. It does. I won't say it will prevent a pregnancy, but it can cause problem with the stimulation and implantation of the embryos. So we have to be careful. That's why we offer, on the day of the embryo transfer, we offer acupuncture or any counseling if they want, so that they are calm and enjoy the embryo transfer procedure. It's a very important procedure. It's the simple procedure. However, it is so important. It has to be placed in the right place, so gently. Embryos are so fragile. We can't just shove it in, It's important. And the woman has to be in the right state of mind. All these things are very important. But now with the pandemic, things are becoming more and more difficult for everyone, because they don't get the support they need.
Yeah. Well, it goes back to what we were saying earlier, doesn't it, about support network. And Divya, you were just saying before Dr. Venkat arrived that you felt very supported by Harley Street Fertility Clinic the whole way through. Is that from seeing lots of different people at different stages?
So yes, I could probably, well, I probably can, but it would take too long. Name every single person.
But the whole being supportive of what you're doing.
Yeah, and every single person at the clinic there has been incredibly supportive, not just of me, but of Tony as well. And what made the difference for us was that in the run up to round 2, for instance, so going back to stress, how much that's like saying how long is a piece of string. So when Tony really supported me as much as he could in terms of helping me recover, and then unfortunately when he fell ill, he kept saying, stress is the killer, stress is the killer. We'll try and do whatever it takes to keep your stress levels down. So we tried acupuncture outside of the clinic. We tried massage, which was great. Still going with that. And we always have a good chat with the nurses whenever I come in for my appointments. Obviously, because of the pandemic, Tony can't come to all of my appointments anyway. But it's safe to say that if he comes in, everybody asks him how I'm doing, or if he rings in, and vice versa. So there's always that sort of point of contact.
That's really good. Thank you both so much for your time tonight. It's been really lovely to talk about, obviously bits of medical advice, but also the holistic and support and like-minded conversations that I'm sure many people listening have resonated with tonight.
Yeah, thank you very much for having me.
Thank you both. Thanks for joining. You see, best of luck, Divya, with your treatment.
Thank you very, very much.
Okay, thank you. Bye-bye.
Thanks. Bye.